Well, earlier this spring, Utah became the first state in the country to ban the use of fluoride in public water.
And Wisconsin does not have a statewide mandate, but DeForest and several other local communities are debating the issue. Dr. Zorba Pastor is here with this discussion. Hello.
Hi, Zorba, good to see you.
Yeah. So let's look at the history. The history started in 1905 when an East Coast dentist decided to go to Colorado Springs and noticed that the people there had brown teeth, but they had no cavities. And then over a period of the next 30 years, they discovered there was fluoride in the water, that fluoride helped teeth, that too much fluoride wasn't good in the water. And then in 1953 in Grand Rapids, Michigan, it's the first city that decided to fluoridate water. They did it, they followed 30,000 children for 15 years and discovered that when you fluoridate water, you reduce cavities by 65%. And basically over that time, that's why we fluoridate water.
Yeah, and it's become very controversial. And how did that start? I was reading one of the things I read, like the 50s and 60s, was there a theory about a communist plot?
Oh, yes, that's
fluoride?
right. It was crazy that communists are putting fluoride in there, and this idea that it causes autism, it does not. That it causes a drop in IQ, it does not at all. But the question is, do we need it? Now, in European countries, they don't fluoridate the water. In France, in Spain, in Germany, they don't fluoridate water. In the UK, they don't. And when you look at the cavities, the number of cavities they have, we have more cavities than them in certain areas of the country or not. But the important thing was in the 50s, they started adding fluoride to toothpaste.
Yeah.
So when I was a kid, Crest toothpaste was the first toothpaste, and their commercial was, "Hey, Mom, no more cavities." That was like the slogan. So what's happening is that we are also getting fluoride through toothpaste, through our dental office, and the question is, do we still need it? So in the communities where they've dropped fluoride, there may be an increase in cavities, and I think fluoride is still good to keep in the water.
So if that's your, I was just going to ask you what your medical opinion is.
I think from a public health point of view, it's important to keep fluoride in water. On the other hand, our children were on well water. So we didn't have fluoride in our water in our house. So we made sure they brushed their teeth twice a day with fluoride. And kids, when you spit out the toothpaste, you still swallow some. So they were getting fluoride that way. But I think it's important to keep fluoride in there. I absolutely do.
Yeah. And part of the discussion is some people do not like having their individual rights, how they feel taken away.
Of course.
And
who wants to wear seatbelts? Who wants to have a driver's license? Who wants to do all the things that we have to do as society to keep us healthy?
The common
good. The reality
good.
is, that's it. There's a certain amount of things that that we do that keep us. But yes, that's the idea behind that. But fluoride is still going to reduce cavities, and that's so important in children. One of the reasons we still have cavities is we eat too many sugary foods, especially at night. We don't brush our teeth twice a day, and we don't floss as adults. So those are the other things that are important. It's the reduction of tooth decay.
But isn't there concern beyond just cavities? Doesn't the research show people are concerned about other things?
Well, people are concerned, and there's no scientific proof that it drops IQ and it causes autism. And there is no scientific proof of this. Just because famous, rich, handsome, beautiful people say it's true doesn't always mean it's true.
What? Well, and another thing that I've read, people who are proponents of this say that it is preventative health care, especially for lower income families. Dentistry is expensive.
Right. And the other thing about in Europe, dentistry is free. So one of the reasons that they have better teeth in Europe is because they have free dentists, and we don't have that in our health care. So fluoridate the water, it's better for us.
Very good. Thanks for being on with us.
Good to see you, Zorba. Thank you.